Outbreak of the Ebola virus in West Africa was first reported by the World Health Organization, and this happened in March last year. The outbreak began in Guinea, subsequently spreading to Liberia and then to Sierra Leone. In Sierra Leone alone, the disease has left about 12,000 orphans. Yesterday, the Aurum Institute, that's a public benefit organization specialising in response, treatment and research efforts to eradicate TB and HIV, held a session to give an update on Ebola. We are now joined in studio by Dr. Paul Davis. He is the chairman at the Aurum Institute. It's very good to have you. Thank you very much for being with us here on the program.
Thank you very much for having us.
Absolute pleasure. It's amazing, you know, last year, that's all I remember speaking about was Ebola. Ebola was in the news, Ebola was in the newspapers, we spoke about it, we warned people about it. It seems we're speaking about it less and less. Does that mean the situation is improving quite dramatically?
It's certainly improving, there's no question about that. And it's a direct response to the onslaught that the world has focused on that area to at least contain the disease, if not eradicate it.
Yeah.
But it's not gone yet. This last week there were 132 reported cases. The week before about 99. So it's still around, and with it, like any epidemic, and particularly this type of epidemic, it can flare up. What has happened is that the health services in those regions have been bolstered and boosted and are prepared now and with knowledge and know-how to start to manage that disease.
Do we know as yet what actually triggered the outbreak of Ebola?
No, we don't.
No.
We think that the reservoir host where the Ebola virus can live for years without detection is perhaps the fruit bat, which is prevalent in that area and other areas, but mostly in equatorial regions. Yeah. And some contact with the fruit bat through primates, chimpanzees, humans but once it's in humans, the potential for that disease to spread is frightening. Yeah. It's a very tenacious and vicious virus.
Yeah, it certainly is. I mean, it's at one point, which was almost uncontainable. Is it contained now? I mean, you speak of huge numbers still, but you know, just getting that contamination under control. Can we say it is under control?
It's becoming
under control.
It's nothing like it was.
Okay.
Where with the predictions were 10,000 new cases a month at one point.
Sure.
But it's not in that region. And also the management of the disease, despite the fact that there's no specific treatment yet, is much better. When the disease started, the fatality rate was around about 90%, and now it's been reduced to around about 50%. That's still high, very high. Yeah. But it still means that they're picking up the disease earlier and they're learning how to manage the disease without specific treatment for the virus.
I want to speak about treatment in a short while, but just before we get there, how often do we see outbreaks such as what we're seeing with Ebola?
Well, the first outbreak that we were aware of was in 1976. And then sporadically, maybe 4 or 5 incidents up to this one. But the difference is that in the first epidemic, or the first exposure, small villages were involved in very rural areas. Now it's moved to both rural and urban areas and across countries. So the virus itself is now more prevalent in areas where it wasn't probably there before. And that's of great concern.
So now we know, you mentioned it now, there is no specific treatment, but yesterday during your press briefing you spoke about a vaccine that's being tested. There are trials currently underway. How far are we from finding a cure?
I think we are close, but these things take a long time. I mean, as we said yesterday, the process of developing the vaccine has been accelerated in the case of Ebola from about a 15-year from design of the vaccine to safe testing of the vaccine to 1 year. I mean, that's a fantastic and still cognizant of the safety measures. And I think it's an indication of how seriously the world takes on this disease. I mean, and the point is that there are vaccines, and there have been specific treatment using the serum from patients who've had the disease in order to treat those who've now contracted the disease. So there is some hope, but it has to be on a large scale. That's why vaccines are being looked at. There's no specific antiviral agent other than something to boost your own immune system to tackle the disease once it gains entry into you.
You know, it's quite amazing. We talk about Ebola, we talk about vaccines, cures, trying to contain a situation, and yet as we live here and we live in an environment where we almost have a ticking time bomb underneath us in the name of tuberculosis and TB. That's something that we need to look at very, very carefully in South Africa.
Well, South Africa's got two epidemics of a major nature existed now. The first one is HIV, and with it, and almost inseparable from it, is tuberculosis.
Absolutely.
You know, it's not just an epidemic. It's not a pandemic, but it's a hyper-epidemic. The incidence of those diseases in this country is almost the highest in the world.
Yeah. So where are we when it comes to TB? Controlling TB? We'll talk about HIV now, but let's talk about TB firstly.
TB. TB is a manageable disease, and that's the important thing that it's become more difficult in the last couple of years because there are resistant strains of TB to the various medications that were available. But the point is that TB should be a manageable disease, and if given the proper treatment, you should be cured of that disease, whether you have HIV or not. The vaccine for TB is in process. There are about 6 candidate vaccines that we are looking at to see how efficacious they are, but that's still some time off. And interestingly, there's not the same amount of urgency related to the development of TB vaccines as there has been with Ebola. And yet the incidence of TB and the deaths related to TB are far in excess of those that have died of Ebola.
Yeah, and that's in question. I mean, that really is I suppose one could really wonder why that is the situation. As to why there isn't such an urgency surrounding TB.
You know, I can speculate. It's often the circumstances in which the disease occurs. It's not an aggressive disease in the sense that it doesn't flare up on Monday and you're dead on Thursday. Everything takes time, and as a result of that, there doesn't always seem to be an urgency associated with that, as well as that TB has been around for a long time, and perhaps we've just got TB fatigue. We hear about the disease and we don't focus on it. When we started working in TB, there had been no new TB drug developed for 40 years. We were just using the old thing and accepting that was how you could manage the disease.
Indeed, and that is, I suppose, you get fatigue around things like that. And another issue is HIV. I know that they're very much so linked. Talking about trials, talking about vaccines, how far are we from looking at that?
It's the same. They're in process. I think our own organisation is looking at about 4 candidate vaccines, and other organisations in South Africa are looking at others. But I think it's still a long way off before they are proved to be efficacious, and more importantly, that they prove to be safe.
Yeah, indeed.
So I think we, don't expect anything this year or in maybe even 5 years' time.
In 5 years' time. I mean, this is something that's been around for years and years and years.
Well, TB is probably older than humanity. So it knows us very well. And its ability to hide and duck and evade everything we do to get rid of it is a learned response over millions of years. So it's a very difficult bug to handle.
Well, with the advent of antiretrovirals, that of course has offered a lot of relief. And that
absolutely.
Was
I mean, the whole issue around HIV, which was a uniformly fatal disease, if slow onset when it started, is now a disease that you can easily live with, much like diabetes or maybe even heart disease. That given the right treatment, your life expectancy could be almost close to normal, and your ability to live that life normally is pretty well close to being normal.
Certainly is. Doctor, thank you very much for talking to us here on the program. But just as we're talking about the fact of looking at how the world reacted to Ebola, how the world is reacting to Ebola, it's still there, it's still an issue, and we still need to be very, very vigilant about it. But issues like TB and HIV, those are top of the agenda when it comes to trying to find a cure on those. Thank you very, very much for talking to us here on the program about those important issues. All right. Now